Hey everyone! Your skin might be sending you a message that your cortisol levels are elevated. In today's video, we'll explore 8 indicators of high cortisol. So, what exactly is cortisol? It's a hormone produced by your adrenal glands, crucial for your overall health. Cortisol influences nearly every organ and tissue in your body, playing a major role in regulating your metabolism and controlling how your body processes proteins, fats, and carbohydrates. This hormone is also vital for maintaining blood sugar levels and blood pressure, as well as managing your body's response to stress. Additionally, it helps reduce inflammation and regulates your sleep-wake cycle. Your body uses several mechanisms to ensure cortisol levels stay in check, as both excess and insufficient amounts can have serious consequences. It's all about keeping things balanced, much like the just right concept in Goldilocks. When cortisol levels are too high, various signs may start to emerge. First up is weight gain, particularly in specific areas of the body. People might notice increased fat deposits in the face, leading to a rounded, fuller look, often referred to as moon face. There may also be fat accumulation in the upper back, giving a hump-like appearance. Another common area for fat deposits is above the collarbone, making the neck seem shorter and thicker. One of the most noticeable signs is abdominal weight gain, where the midsection enlarges while the arms and legs may remain slender. Rarely, about 8% of people might experience fat buildup behind the eyes. The second sign to watch for is skin thinning, which tends to be most evident on areas like above the knees, giving the skin a wrinkled, almost crinkly appearance, similar to damp tissue paper. This fragile skin is highly susceptible to tearing. You may also notice this thinning on the backs of the hands, a common area where high cortisol levels lead to easy bruising and skin tears. With elevated cortisol, the skin's structure becomes compromised due to the atrophy of both the epidermis, the outer skin layer, and the dermis, the deeper layer. This results in skin that's much more delicate. As the layers of the skin thin out, blood vessels become more visible, often presenting as dilated vessels or telangiectasias. Another indicator of this fragility is when removing adhesive bandages. The skin peels or tears easily, reflecting how sensitive and weakened it has become. The third sign of high cortisol levels is the appearance of stretch marks, medically known as striae. These marks emerge because the skin becomes thinner due to dermal atrophy and, in many cases, sudden weight gain, particularly around the abdomen. Stretch marks may also develop on areas like the inner thighs and arms. Unlike the typical pink to silver stretch marks that occur with weight gain, growth spurts, or pregnancy, cortisol-related stretch marks are wider, about a centimeter in width, and have a vivid purple or bright red hue. They can also appear on the buttocks, thighs, lower back, and even the breasts, standing out more noticeably than common stretch marks due to their distinct color and width. The fourth sign of high cortisol levels is a skin condition known as acanthosis nigricans. So, what is this? Acanthosis nigricans appears as a dark, velvety thickening of the skin, often with a grayish-brown tone. It's commonly found on the neck, but can also occur on the face, under the arms, and even on the backs of the hands. This change happens at the level of the epidermis and is usually a sign that your body is struggling to respond to insulin, a condition known as insulin resistance. That's why acanthosis nigricans is often associated with diabetes. Since cortisol plays an essential role in blood sugar regulation, high cortisol levels can disrupt insulin function. When insulin levels rise due to insulin resistance, the skin responds by developing these dark, velvety patches, serving as a visible clue of underlying metabolic or hormonal imbalance. Sign number 5 is steroid acne. Yes, high cortisol can lead to a type of acne that's quite different from the usual breakouts you might experience. Steroid acne is distinct because it tends to erupt suddenly, with all the lesions appearing nearly identical. This uniformity is known as monomorphic. It commonly shows up on the face, neck, upper chest, back, and upper arms. Patients with high cortisol levels due to medication may develop this type of acne, which might be linked to a yeast called Malassezia, or Chitospora, that naturally exists on the skin. High cortisol levels can suppress immune function, allowing this yeast to thrive, which can trigger steroid acne. This reaction is partly due to the immune system responding to substances it previously ignored, resulting in these uniform acne lesions. Sign number 6. We can have some significant changes in hair growth. Why does this happen? As I mentioned earlier, the adrenal glands, which produce cortisol, also produce androgens, hormones that affect hair growth and can lead to hair thinning. This process is known as androgenetic alopecia, where hair follicles respond to androgens by miniaturizing, leading to finer baby hairs. In women, this often appears as a widening of the central part, while men may notice a receding hairline, though it can vary. Elevated cortisol can accelerate this hair thinning process, making it more intense and rapid than typical genetic hair loss. Additionally, some women may experience hirsutism, or male pattern hair growth. This can involve coarse hair appearing on the upper lip, sides of the face, upper chest, around the areola, abdomen, and upper thighs. Another potential change is an increase in lanugo hair, fine, downy peach fuzz that may grow on the face and body. These changes are directly influenced by the rise in androgens linked to high cortisol. Sign number 7 is delayed wound healing. Why does this happen? As we discussed earlier, cortisol reduces inflammation, which might sound beneficial, but inflammation is actually essential for healing wounds. The body needs a certain amount of inflammation to trigger the healing process, and with high cortisol levels, the body's inflammatory response is dialed down too much, which slows down recovery. If you get a small cut, for instance, it's likely to take a lot longer to heal, with a higher risk of bruising and scarring. Minor scrapes or bumps can become a bigger issue as well, since the skin is already thin and fragile from high cortisol, which makes injuries take extra time to heal. This slow recovery also raises the chance of infections, as wounds remain open longer than they typically would. Sign number 8 of high cortisol levels is an increased susceptibility to skin infections, particularly those caused by fungi or yeast. Elevated cortisol weakens the immune system, making it easier for these organisms to thrive. For example, Malassezia, also known as Chitospora, a yeast that usually exists harmlessly on the skin, can start to overgrow, leading to conditions like steroid acne, as mentioned earlier, or tinea versicolor, which causes patches of discolored skin. High cortisol also heightens the risk of infections from fungi, known as dermatophytes, which are responsible for common issues like athlete's foot, toenail fungus, and other nail infections. Another yeast, Candida, may also flourish when immune defenses are down. This can result in infections in areas like the mouth, known as thrush, or angular cheilitis at the corners of the mouth. Additionally, Candida can infect skin folds, such as under the breasts, or cause vaginal yeast infections. High cortisol essentially impairs the immune system, making these infections more frequent and difficult to manage. What exactly causes high cortisol levels? Sometimes, elevated cortisol comes from external sources, such as medications. For example, certain drugs, known as glucocorticoids, like prednisone or dexamethasone, are commonly prescribed to reduce inflammation and manage conditions like asthma or autoimmune diseases. However, taking these in excess can lead to an increase in cortisol levels, causing the symptoms we discussed today. In some cases, even topical medications containing glucocorticoids can lead to high cortisol. These creams or ointments, often prescribed for skin conditions like eczema or psoriasis, vary in strength and absorption rate depending on the type, the area of application, and duration of use. With long-term use, especially of potent formulations, some individuals might develop signs of cortisol excess. There's also a risk with certain over-the-counter skin products, particularly skin bleaching creams. Some of these creams may contain undisclosed amounts of glucocorticoids, which can lead to symptoms resembling Cushing's syndrome in users. While using corticosteroids under medical supervision is generally safe, caution is advised with non-prescribed products, as they may unexpectedly elevate cortisol and lead to health concerns. We've talked about medications that can elevate cortisol, but certain dietary supplements can also play a surprising role. Some adrenal support supplements have been found to contain undisclosed glucocorticoids. People may experience symptoms of high cortisol, like those seen in Cushing's syndrome, only to later discover it was linked to one of these supplements. While these cases involve external sources, there are internal causes as well. For example, tumors can lead to elevated cortisol. Some tumors produce excessive amounts of ACTH, which in turn stimulates the adrenal glands to make more cortisol. This type of tumor is often found in the pituitary gland, located in the brain, but it can also occur in the lungs. Though less common, tumors in other locations can have the same effect, continuously signaling the body to produce more cortisol and leading to symptoms of high cortisol levels. To sum up, staying aware of the signs of high cortisol can make a big difference in your health. If you notice any of these symptoms, consider checking in with a healthcare provider. Thanks for watching, and take care.